This is Sarnia Lambton Daily for Thursday, April 16th. Good evening, I'm Terry Doyle. Lambton Public Health has declared a second outbreak at a long-term care facility in the region. A staff member at Lambton Meadowview Villa in Petrolia has tested positive for COVID-19, leading to the outbreak being declared. That staff member stopped providing services to residents as soon as their symptoms appeared. Lambton Medical Officer of Health Dr. Sidit Ranade says measures were already taken to limit the exposure to the virus in the home.
It's important to remember that in advance of this outbreak, restrictions and other kind of protocols have been in place for a few weeks now. So that's important to know, because normally those things would ramp up after an outbreak has been declared, and in this case they were already in place. So when you would declare an outbreak in a long-term care home, we would typically restrict visitors. We would be there are certain protocols and procedures for staff, and those things, many of those things were already in place prior to the identification of a case. That's encouraging. But having said that, now we're on the lookout for anybody with symptoms in the facility, whether they're resident or staff, and looking to get them tested very quickly.
The total number of positive cases of COVID-19 has jumped to 128, up 9 from Wednesday's number. 61 test results came back, 9 positive, 52 negative. The availability of tests for COVID-19 in Sarnia Lambton is expected to increase. A new assessment center is opening in Petrolia, in addition to the center that was already opened in Sarnia in mid-March. The overall number of tests available in the region will also be increased.
I can't predict what's going to happen with the numbers of tests, but I can tell you that what we're trying to do is improve access to the test. Also, what we're doing is looking to expand access in terms of long-term care homes and retirement homes to make sure that anyone, especially anyone who has symptoms, can get a test quickly. Many of those things were already happening. We just are anticipating, as the demand grows or as there will be more symptomatic cases, that we want to make sure we have the capacity to test them quickly and report on those tests as fast as they can come in. Essentially, if you think about the spectrum of people who should be tested, ideally, if we had all the tests in the world, we would definitely want, at a minimum, for anyone with symptoms to be tested, even if those symptoms are mild. Now we have enough tests to be able to potentially do things like that, and so we can expand access and we can make sure that people in vulnerable settings are tested as soon as they have any symptoms.
It is important to note that you still need a referral to get tested. The testing centers are not accepting walk-ins. Elsewhere, the City of Sarnia and Blue Water Health is working together to collect donations of new and unopened industrial or medical personal protective equipment. This includes N95 masks, gowns, vented goggles, and many more things. A drop-off event will be held this Saturday at Clearwater Arena. You can find out more information on the City of Sarnia's website. Let's head to Point Edward now and check in with Mayor Bev Hand, who joins us now from our office. And Bev, let's talk about this last month. You know, it's been very busy, I'm sure, for all politicians, mayors, councillors, you name it. What has this past month been like for you?
Well, stressful, as it is for everyone. Everyone's dealing with a lot. And if you talk to different people, they all have a story. But we've learned a lot about technology, learning to do Zoom meetings, and how we can do the Zoom meeting and introduce the public so that we can, be able to operate properly for our council meetings by having the public sign in to the meetings. And I've done that also with county council. So I now have had regular county council, and yesterday was committee meetings that we did online. And the public could come on and listen, except for the in-camera piece.
And I guess that's one, I was going to say, Bev, that's one thing that probably a lot of people don't understand, that it's one thing for a business or you and I to talk over Zoom, for example, but when you're in a situation of council and public, things that the public by law have to be able to access, I'm sure that, throws a little different wrench into it.
Right. So we had to pass a motion that allowed, as did Sarnia and others, that it would allow us to do our council meetings electronically, but there's still provisions around that, is like allowing the public, and the difference is we do a recorded vote, so everybody can be sure of how the votes went, because you're not necessarily looking at hands, right? So, and then more announcing yourself when you're talking, that type of thing. So we went over some pointers to be prepared for the first meeting that we did.
Bev, the day-to-day op things, of course, we know about physical distancing, social distancing, whichever term people want to use. Physical distancing, of course, is the one that seems to be adopted more. But what's been going on in terms of sort of day-to-day Point Edward in terms of helping residents stay safe right now?
Well, the mayor, we do a twice a week newsletter, the mayor's newsletter, try to put in, points around what's changed on our garbage collection, blue box, anything of that nature. Any announcements like we canceled our heavy lift or heavy pickup day, and keeping people abreast of that, and just asking them to be patient and understanding as we adapt. Sometimes we're getting information late, as things happen, and then communicating to our residents. And of course, then we've adopted, our arena is closed. We've adopted social distancing within our works department, and also in the water department. But there are essential services that need to continue to ensure that the safety and for the municipality.
Has it been an additional challenge that you have some areas in Point Edward that are a destination for people outside of Point Edward? Of course, we talk about the bridge area and the waterway. Has that been an additional challenge?
For sure. Like, just, everyone knows that, well, the municipal accommodation tax was brand new in January. And so we got 2 payments, and then that came to a screeching halt because one of our brand new hotel is totally shut down, and the rest of them are pretty well running at reduced occupancy and not opening up the whole hotel. So there's another impact financially in that regard, but that was new revenue to us. So we've adapted in our budget to allow for that difference.
And what about as well the challenges when to maintain physical distancing? And I'm thinking also those destinations like the waterfront, where I know, for example, the parking lot down by the bridge is closed off, but I've got to think your staff had to really move quickly to put those rules in place, especially once the provincial government put the rules in.
Yes, one thing that's been helpful is I'm part of the control group. We're working collaboratively with Sarnia, the police, the fire, like within that Sarnia and Anjouan, and everyone talks it out together so that you have a heads up on decisions. So when Sarnia had made the decision regarding the waterfront and closing the parking lots at the Laws plant and at the end of Fort Street, then we immediately swung into action. The staff here in the village did an excellent job of closing off the waterfront. I mean, it was, to me personally, a really sad day because I've lived here my life, and now, to go down there and see there's no cars sitting there. But a lot of people didn't understand that the walkway is still open. So we encourage people to do, get some physical activity and continue to walk as long as they do it appropriately. And there's people out all day long on those trails, like up to the animal farm and like that. So I was glad that we've been able to keep the trails open.
I was down there on Easter Sunday out for a walk as well, and it was good to see. It was a beautiful day, and people certainly out there very busy enjoying that. For the most part, have you found indeed that people have been, from what you've seen, following those things in terms of keeping their distance? The trails are pretty wide, that one person can sort of stay wide one side, one can stay wide on the other. Have you found for the most part, now that people have gotten used to it, they've sort of followed the right guidelines?
I think so. The only challenge was you could see a difference as the weather improved. Like some of those bright sunny days, like it was like a flood of people. Personally, what I started to do is walk the streets of the village instead. It was just easier. You're not, bobbing around people when the trail gets really busy. And then so I could, see what was happening in the village by doing the street walking.
Worked out pretty well.
Yeah.
I know you went through some budget process recently. It was already sort of in the works, and then this hit. The casino,
yes,
of course, is a major revenue stream for the village. It's not operating right now. I'm sure as you were doing your budget, that had to come into play.
Yeah, so we spent 5 hours on Zoom in a council meeting on Tuesday. It was open to the public. And just what had happened is we were going to do our budget in late March, and we had spent time on it, but we hadn't finalized it. And the March meeting got canceled because that's, when everything fell apart. So we went at it Tuesday, and we went through all the revenues and made adjustments. And then went into, talked about our capital projects, what could be put on hold, what could be stopped, where were we, you know, in terms of starting, and went through all the operating budgets, and we achieved a 0 increase for 2020. So this Friday, we're going to do another council meeting online and confirm that budget.
I've got to think there was a lot of pencil sharpening, but you must be proud of the way that council and staff
you know,
were able to
our
work
managers all contributed something. You know, they spent time before the meeting and were very thoughtful about it, and everybody worked together, and we were able to get to the 0. So I mean, we wanted to respect our residents in the situation that everyone is in, and to do whatever we could, you know, as well as, you know, we're not charging penalties on water bills and taxes, things like that, but we wanted to do everything possible. So now the 0 on the tax is our portion. We can't control the county or the school board, but 0 from the village side of it. So that was, I thought that was a good achievement.
Bev, what have you noticed as we wrap things up on a positive note in terms of neighbors helping neighbors and friends helping friends, and of course assisting seniors, things like that in the village?
There's so many stories. I saw one yesterday where a gentleman who has health issues, and he was congratulating and thanking some neighbors that had all through this had gone and gotten groceries and checking in on them. And there's so many stories like that going around, like people helping people. So it's not all negative. So I think it helps people too to be able to focus on something other than themselves and what they're doing and what they're dealing with, to be able to look and help someone else.
And it's great to see when that always happens. That's why we want to leave things on a positive note. Mayor Bev Hand, yes, we appreciate you joining us, and stay safe, stay well, and we'll catch up with you again soon.
Okay. Thank you, Terry.
There's Bev Hand, the Mayor of Point Edward, joining us from her office. Stay tuned, more to come on Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily. Well, of course, as we go down by the waterfront, we look across and we see Port Huron, Michigan, and while traffic normally goes back and forth, it is very quiet right now when it comes to that. But we want to check in to see how our neighbors in Port Huron, Michigan were doing, and Mayor Pauline Repp joins us now. And Pauline, right off the bat, how are things going right now?
Well, things are going as well as can be expected. I mean, I think you have a lot of frustrated people, and obviously no one saw this coming, and no one wants to be where we are. But I think, you know, the better side of people shows up in most cases, and I think we're all working together. So best it can be.
What about in general? How are our residents there doing from a health standpoint? We've seen the stories out of Detroit coming in where they're dealing with definitely a very difficult time there. What about in Port Huron and the surrounding area? How are the residents doing?
Well, in St. Clair County, in the county as a whole, there's I think the last report was about 224 cases, 7 deaths. So, you know, that's, you know, in comparison to the total population, that's not a high number. City of Port Huron actually has had 41 cases, and we have a 30,000 population. So you look at it in that ratio. No, I mean, not that anybody wants it, and the deaths have been spread around the county, but I think there's been maybe only 1 or 2 in the city of Port Huron, actual residents of the city of Port Huron. So, I mean, when you look at it in perspective, it's not that we've had that many, but you certainly want to keep it from getting a lot. I mean, the city of Detroit is really suffering and having a lot of problems, and they're only an hour south from us. So, you know, you kind of want to put that shell around you and hope that it doesn't happen here quite to that extent.
Speaking of that, what are the rules in place right now for residents when it comes to maintaining social and physical distancing?
Well, basically, we're following the governor's rules, which is that you can only go out for necessary trips meaning to the grocery store, picking up takeout, going to the pharmacy, or perhaps if you're in charge, I guess, of elder care, you can go out and help. You know, someone like your relative, you say your grandmother or somebody needs help, then you can do that. Other than that, you really are sequestered at home, which is kind of tough, because even from my own perspective, you don't get to see your kids or your grandchildren. You FaceTime them, or you talk to them, you know, in another manner, Zoom meeting or something like that. But you know, it's been a month since I've seen anybody in my family other than my husband. So it's, and I've only probably gone out maybe once or twice a week, once to the grocery store and maybe once to pick up some takeout. So your trips are limited. So you kind of, you can go out and exercise. That's the other thing you can do if you want to walk, or you want to walk your dog or bicycle, any type of outdoor exercise, except that we did have to close our parks because we were finding that people were congregating too close in the parks. You know, you had a group of, say, young men playing basketball, which of course is a contact sport, so to speak. So you can't do that. And then you don't want them on the playground equipment because there's nobody there to wipe it down every time somebody gets on a piece of playground equipment. So we did have to close it down for those types of activities, but certainly not for walking or that type of thing. So it is pretty restrictive. And I think that, you know, that's very frustrating for people, for myself as well. I mean, it's, you know, the reasons why, and you adhere to them, but it's still frustrating.
And certainly some of the things you said are exactly what's gone on this side of the border in terms of the playground equipment and the parks and things like that. We've seen similar rules and being out for when you've made those short trips out. How, do you find, and from what you're hearing with your staff and your colleagues, that people are, for the most part, adhering to the rules? And you know, what happens in terms of enforcement? Here there's certainly some enforcement that's gone on both in Sarnia area and throughout the province of Ontario. Have you found most people are following it and there's had to be maybe some limited enforcement?
Yeah, most people are following it. I mean, even when I go to the grocery store, you find that most people, I mean, our grocery stores, I don't know what yours are like over there, but our grocery stores are such that most of them have changed the aisles, so they're one way. So you go up one and down another one, so you're not passing anybody in the aisles. You have to stand back, you know, 6 feet if you're the next person in line to actually pay or anything like that. They wipe down all the self use areas, and most people, I would say 90% of the people have a mask on. So it's, I don't feel unsafe when I go to the grocery store or anything like that. And I've seen people out walking. Most people don't put a mask on to walk out, just because you can keep your distance of even more than 6 feet if you're just out, you know, exercising, walking, that type of thing. But I think most people adhere to it. Certainly some do not. We're not actively pursuing going after people, but certainly if there's a group of any people, our police are out. If they see a group of 10 people or something like that and they're all together, obviously they're not supposed to be with people other than who you live with. And obviously if there's 10 people out there, it's probably not people you live with. So they will ask them to disperse, but that hasn't really been a big problem.
And I guess that's the thing, communication and education. And have you found that's been the thing where most people, even in that situation, from what you've heard, if there is a lot gathering, once they're told, hey guys, this is not, you know, if you want to walk through the park or walk through the trail, that's fine. But this gathering, it's time to scatter. And they pretty much say, all right, fine, we get it.
Yeah, I know of no instance where anybody's had any kind of issue with that. I mean, even if they don't like it, they still usually adhere to it. But I'm sure there's people that are going and visiting people in homes. I mean, how do you get around that? I mean, it's hopefully it's not much, but I mean, it's hard to police that. I mean, if you're in a neighborhood and you decide you want to go over and see your neighbor, who's gonna be there to stop you? I guess you hope that people adhere to the rules and at least stay 6 feet apart, which is what they're supposed to do in the social distancing. But that's kind of hard to you know, police that.
We know, of course, a lot of people normally go back and forth across the border. The numbers are down way. I think it's single digits, the percentage that's going across. Obviously, trucks are doing that to a certain extent for trade as well. How do you see this could impact the Port Huron area and, of course, north there in Fort Gratiot as well, where a lot of people do their cross-border shopping? What are you seeing or hearing where, you know, the fallout that might come in terms of the economics of the area over the next few months at least?
Well, I think, you know, pretty much it didn't take long for it to hit economically in Port Huron and any place else, really. I mean, across the country, Michigan, it's just not your normal commerce that's going on. And, you know, a lot of places, unfortunately, probably won't make it through. I mean, if you have a small store or something like that, although, you know, how are they going to survive this? But but we do have a lot. I mean, there is a lot of opportunities for businesses to get small business loans or to get grants to pay for their employees' payroll. There's a lot of additional unemployment benefits. Of course, the federal government also gave a stimulus check to anybody that had, it's under a certain income level, but it went quite high because for a joint taxpayer, you got the full amount if you're 150,000 or less. If you're up to 200,000, then it proportionately changed up to that. If you got over $200,000, then you didn't get it, which is certainly what it should be. That's for a joint, half that much if you were a single tax filer. So there's some things that have been put into place, but I think economically it's going to take a long time for people to pick back up, because even if they open tomorrow, you're going to have people that are afraid to go. And they kind of gotten used to ordering online or doing different methods of acquiring their merchandise that they may not fully go back out and shop. I do personally think that it's going to take probably a year or so before we get back into any kind of normalcy.
One thing when we've run this show here is looking for the positives and people helping people. What are you seeing from your residents in terms of helping their neighbors and helping maybe the seniors, for example, to, so they don't have to go to the grocery store? What are you seeing?
Well, there's been a lot of different cases, a lot of little groups that have come together. I mean, we have a group of women who have gotten together and to make masks for everybody if they want them. And that's nice, and they donate them to the hospital and different places. You have, last night, for an example, in the whole area, not just the city of Port Huron, we have 2 hospitals, of course, in Port Huron, but the neighboring fire and police and all of the emergency vehicles and the Port Huron ones, they did a little parade with sirens and lights and drove around to both hospitals in the parking lot, saluting all of our hospital workers. So, and that didn't just mean, that means more than just doctors, nurses, and things like that. I mean, you've got the people who work in the kitchen and clean the hospital and everything else. And that was a nice show. And that was done, not officially, that was done by just the personnel getting themselves together, the fire and all the emergency management doing that. So that was really nice of them to do. And, you've got a lot of businesses that have stepped up and made donations for personal protective equipment for the hospitals and nurses and doctors. So, you have I think that a lot of donations, I don't think you have had any shortage in people being willing that have the money to donate to our different fundings, the United Way and Community Foundation and all those places that help people that are less fortunate. So you have a lot of volunteers. A lot of volunteers are handing out meals. It's just a lot of things in the community. So, I really do appreciate everything that everybody's done to make it better.
Well, Pauline, we'll leave that on a positive note. We appreciate the time, certainly to you and everyone there. Stay safe, stay well, and we will hopefully touch base with you again soon.
Sure. Thank you.
There's Pauline Repp, the Mayor of Port Huron, Michigan, joining us here. Stay tuned. More to come on Sarnia-Lambton Daily on your TV. Back here on Sarnia-Lambton Daily and recapping our top story tonight, an outbreak has been declared at Lambton Meadowview Villa in Petrolia. A staff member of the long-term care facility has tested positive for COVID-19. Restrictions had already been put in place to limit the spread as soon as the pandemic began. Overall, 128 cases of COVID-19 in the region, up 9 from Wednesday's number. That's going to do it for our show tonight. I'm Terry Doyle. We'll see you tomorrow.